Good afternoon, and welcome to the July 2nd Community Update. My name is Zoe Pofu, and I serve as a Public Information Officer in the Emergency Operations Center. This community update is available in Spanish on the Buncombe County Health and Human Services Facebook page at BCHHS. All of our community updates can be found on the Buncombe County YouTube channel or on Facebook at BuncombeGov. Today's update will be provided by Dr. Jennifer Mullendorf, Buncombe County Medical Director and Interim Public Health Director, Esther Mannheimer, Mayor of Asheville, and Fletcher Tove, Buncombe County Public Health Preparedness Director. We'll start today's update with a presentation from Dr. Mullendorf.
Good afternoon. As of noon today, there have been 598 lab-confirmed cases of COVID-19 in Buncombe County residents. 118 of these individuals are currently in isolation. Over 52% of those with lab-confirmed COVID-19 in our county are between the ages of 18 and 49. As I mentioned before, across the country, there has been an increase in COVID-19 in young adults. Over the last 2 weeks in our county, we've seen a 6% increase in cases in 18 to 49-year-olds compared to the prior 2-week period. While the illness often is less severe in young people, some do get very sick and some even die. Younger individuals also may be more likely to show no symptoms, yet still spread the virus. Anyone can be infected with COVID-19 and spread it to others, even seemingly healthy people with no symptoms. All of us, regardless of our age, need to take this pandemic seriously and take action to keep ourselves from becoming infected and spreading that infection on to others. Since the start of the COVID-19 pandemic, there have been outbreaks at 8 long-term care facilities in Buncombe County. A COVID-19 outbreak in a long-term care facility is defined as 2 or more lab-confirmed cases. Public health considers a long-term care facility COVID-19 outbreak over when it has been 28 days with no evidence of continued spread of COVID-19 within the facility. Thankfully, one facility's outbreak has come to an end, so we are now at 7 active outbreaks in long-term care facilities in our county. This information likely will be reflected on next Tuesday's Congregate Living Settings report from the state. Yesterday, a long-term care facility in our county that has been heavily affected by COVID-19 informed our communicable disease staff that the medical director of the facility had conducted a review of the records of the residents of their facility who had died during their COVID-19 outbreak. As a result of that review, the facility's administration reported to us that they had incorrectly reported the deaths of 10 residents of their facility as COVID-related deaths. Our communicable disease staff is updating the numbers accordingly in both the county and state communicable disease data collection systems. Therefore, there will be a noticeable decrease in the number of COVID-19 associated deaths in Buncombe County reported on the county and state websites in the next several days. Based on this adjustment, the current number of COVID-19 associated deaths in Buncombe County residents is now at 30, 25 of whom were residents of long-term care facilities. Again, this change will also not be reflected in today's congregate care facility outbreak report from the state, but should appear on next Tuesday's report. Buncombe County Public Health is aware that over 17,650 COVID-19 tests have been performed on residents of Buncombe County and staff who work in long-term care facilities in Buncombe County since the start of this pandemic response. 2% of these cases, or of these tests performed on county residents, have come back positive based on an average of the past 2 weeks. And just a reminder of who should get tested for COVID-19. Anyone who has symptoms of COVID-19, which include fever, chills, cough, shortness of breath, fatigue, muscle or body aches, headache, sore throat, loss of taste or smell, nasal congestion, runny nose, nausea, vomiting, and diarrhea. Anyone who is a close contact of known positive cases, whether or not they have symptoms. And people in the following groups who believe that they may have been exposed to COVID-19, whether or not they have symptoms. People who live in or have regular contact with high-risk settings, such as long-term care facilities, homeless shelters, correctional facilities, and migrant farm worker camps. People who are at high risk of severe illness, such as people over the age of 65, and people of any age with underlying health conditions. People from historically marginalized populations. Healthcare workers or first responders. Frontline and essential workers, such as grocery store clerks, gas station attendants, childcare workers, construction workers, and food processing plant workers, who are in settings where social distancing is difficult to maintain. And people who attended mass gatherings, including funerals, parties, cookouts, particularly if they were in crowds or other situations where they couldn't practice effective social distancing. If your healthcare provider does not offer testing, contact one of the local urgent cares or clinics who do. The state website has a Find My Testing Place resource with up-to-date information about testing locations across North Carolina. Buncombe County Government and Western North Carolina Community Health Services will continue to offer COVID-19 testing at community-based testing sites throughout the county. The next testing event will be on Sunday, July 5th, from 1:30 to 5:30 p.m. at AB Tech, off Genevieve Circle in the Allied Health Building parking lot. And next week, we will begin our second round of testing at the same sites as this week. So on Tuesday, July 7th, testing will be available in East Asheville, or in East Buncombe at 2217 US Highway 70 in Swannanoa in the Ingalls parking lot. And Thursday, July 9th, testing will be available in Inca at the Buncombe County Sports Park. At both the Swannanoa and Inca locations, testing will be offered to staff of our smaller congregate care facilities from 9:30 to 10:30 in the morning, and then open to the general public from 10:30 until 1:30. Just a reminder that there is no out-of-pocket cost for testing at these community testing sites, but we do ask that those with health insurance, including Medicare or Medicaid, to bring their insurance card with them so that their insurance can be billed to cover the cost of the test. This is a holiday weekend when we celebrate our country's independence. And in past years, that meant getting together at cookouts or to watch fireworks. This year is different, and it must be different due to COVID-19. As Fletcher stated so well in our last community update, this year, the patriotic thing to do is to wear a face covering, keep 6 feet away from others outside your immediate household, and not gather in large groups. Wearing a mask or face covering is a simple but powerful action, and one of the most important actions that each of us can do to take control over this virus. Every contact counts, so continue to reduce your contact with others outside of your household to keep your risk of exposure to COVID-19 lower. And keep washing your hands. You have the ability to protect your friends, family, our community, our economy, and our country by following these simple steps. We can all do this, and we can do it safely. Thank you.
Good afternoon. My name is Esther Mannheimer, and I'm Mayor of the City of Asheville. Thank you for joining us today. As you have heard by now, the governor issued an executive order last week mandating the wearing of masks or face coverings in public, both indoors and outdoors, when social distancing cannot be achieved. The COVID-19 pandemic has had an enormous impact on our daily lives, as well as on our economy and just our sense of normalcy. Over the last few months, our public health leaders have learned more about how to prevent the spread of COVID. There are still many uncertainties, but one thing we know for sure is wearing a face covering will help prevent the spread of germs and airborne pathogens like COVID-19. This weekend, many of you will be celebrating the 4th of July. I know this is a time we typically enjoy with cookouts with friends and families, gathering together to watch fireworks. We can still celebrate and be together, just in different ways. Since we're not able to be together, and the in-person fireworks displays have been canceled by the cities in Buncombe County as well as the county itself, the Asheville Downtown Association will host a virtual Independence Day celebration on the 4th of July. It begins at 4 p.m., and it's an online concert event presented by Ingalls Markets with the support from Explore Asheville and produced in partnership with the City of Asheville. The event will feature 8 local Asheville area bands performing at local venues such as Asheville Music Hall, the Gray Eagle, Isis Music Hall, and the Orange Peel. Drop in to listen for a while or check out the whole 4 hours. You can do this, drop in, by tuning into IMAVL's YouTube channel. That's IMAVL's YouTube channel to enjoy virtually a diverse offering of local music on the 4th of July. If you do go out to support one of your favorite restaurants or a local shop, please respect each other and do it safely. Wear a face covering, maintain social distancing, and wash your hands regularly. It is vital that we work together to slow the spread of COVID-19. Following all public safety guidelines are simple steps to show consideration to each other. Happy 4th of July.
Good afternoon. I'm Fletch Tove, Public Health Emergency Preparedness Director. As a nation, we have just recently eclipsed 130,000 deaths due to COVID-19. And we are on track to possibly suffer 250,000 COVID-19 related deaths this year. Locally, our numbers are not as dire, but our data trends are still moving in the wrong direction. There's still a possibility of overwhelming our local healthcare systems later this summer, and the best tools we have to prevent that are wearing a face covering, waiting 6 feet apart from others, and washing our hands, cell phones, and other high-contact surfaces with increased frequency. We have had a statewide mandate to wear face coverings in public for almost a week now. Most of the community has taken this mandate and other public health guidance seriously, and we thank them for that. Wearing a mask is how we get to a place where we can fully reopen local businesses, how we can make it safer for our children to return to school in the fall, how we can continue to protect our most vulnerable. As we celebrate the 4th of July this weekend, let's do so in a responsible manner. Keep your distance from others. Keep your groups small. Try to keep things outside. And if you're sick or have symptoms related to COVID, do not go to a party or other gathering. And wear a mask. Masks are patriotic. This July 4th, there's no better symbol of being a patriot than wearing a mask. This is a simple and small act that protects your family, your friends, and neighbors. A small act that supports and protects local business and the local economy. And a small act that can slow and limit the spread of the disease that has already claimed the lives of 130,000 fellow American citizens. There are still many who are refusing to wear a mask, and unfortunately, this topic has become politicized. But the science behind the impact of wearing a face covering on slowing the spread of COVID-19 is undeniable. Regardless of politics, if you care about the local economy, if you care about our school children returning to a safe place in the fall, if you care about your family and their friends and the family of your friends, wear a mask. I wear a mask to protect you, and you wear a mask to protect me. When all of us work together in this, we can significantly prevent the transmission of the virus and protect our community. Per Governor Cooper's executive orders, public health does not have enforcement authority for businesses or individuals who do not comply with the face covering mandate. The provisions of the governor's order will be enforced by state and local law enforcement officers, and noncompliance is punishable as a Class 2 misdemeanor. We encourage anyone who has concerns or complaints about violations of these orders to contact their local law enforcement agency on a non-emergency line to file a report. Investigation and possible enforcement of any order is at the discretion of the local law enforcement agency that has applicable jurisdiction. They cannot cite an individual worker or customer, but if a business has asked a patron to leave and they refuse to do so, law enforcement can charge that person with trespassing. Businesses still retain the right to deny service or modify service delivery when patrons do not comply with the mask mandate or have an exception. I want to share a statement from the Buncombe County Sheriff's Department, from the Office of the Sheriff, regarding the enforcement of face coverings and the mandate. We want to educate and inform about what the executive order does, and we know that business owners in our community want to keep their workers and their customers safe. We're hopeful that by taking this approach, we can get voluntary compliance, but we always have the ability to write citations. Thank you, and as always, let's be safe, let's be smart, and let's take this step by step.
Thank you to Mayor Esther Mannheimer, to Dr. Jennifer Mollendor, and Fletcher Toe for their very important updates and timely information. Their presentations conclude our briefing, but before, we want to also thank you all for tuning in and want to send a reminder that our top priority is the health and safety of all Buncombe County and Western North Carolina residents. Also want to send a thanks to my colleagues and to our partners in the Emergency Operations Center who work alongside us to make sure our community continues to receive reliable and accurate information, as well as the resources they need to reduce the impact and to lower the spread of COVID-19. Another reminder that as we move into this holiday weekend, that we would like to send further encouragement for all of us to remember that COVID is still here and that it is indeed spreading. We urge you all to celebrate in the safest way possible by staying outside, if possible, practicing social distance and physical distancing, wearing your mask, washing your hands, and often staying at home if you're not feeling well. It's okay to celebrate at home. as we all know, the importance of July 4th. As a final reminder, you can participate in our community mobile testing sites that Dr. Mollendor shared, Tuesdays at the Ingalls on Highway 70, Thursdays at the Buncombe County Sports Complex, and on Sundays at the AB Tech Allied Health parking lot on Genevieve Circle. Again, a reminder that the first hour will be reserved and is specifically dedicated to our long-term care staff. Thank you again for tuning in to today's update. We will provide the next community update on Thursday, July 9th at 2 p.m. Until next time, be well and stay safe, and have a healthy weekend. Thank you.